Just over 3 minutes from starting this inaugural lecture and discussion of Immunization Agenda 2030. We're privileged to have Drs. Ann Lindstrand from the WHO and Robin Nandy from UNICEF, who will be presenting, doing a formal presentation, and it's important that we do so of the Immunization Agenda 2030. So this is, if you're just joining us now on Facebook, YouTube, LinkedIn, or Twitter, a warm welcome to you. I see already many greetings. Do tell us what city and country you are connecting from. Don't just say the country, and tell us, if you can tell us, say a word about what you do. That is also appreciated. So I'm Reda Sadki from the Geneva Learning Foundation. I'll be introducing our speakers, and together with Charlotte and Boo, we'll be facilitating so that we'll be looking at your comments. So intros are nice, so please do introduce yourself, but really what we're looking for are your questions. When you hear about this Immunization Agenda 2030, when you look at your daily work, what is it that you want to know? So once we have heard the initial presentations, the rest of this event will be dedicated to your questions. And of course, we have two of the top global people from UNICEF and WHO, Dr. Ann Lindstrand and Dr. Robin Nandy, who are here with us, taking time out from their schedule, just as you're taking time out from your own, in order to really connect with people in countries who are, who ultimately, at the end of the day, Immunization Agenda 2030 will be in your hands. So in 1 minute and 30 seconds, we'll be starting. We'll be right back. A warm welcome to you from Geneva, Switzerland. I'm Rida Sadki from the Geneva Learning Foundation, and we're here today as we kick off the WHO Scholar Level 1 certification around Immunization Agenda 2030. We're privileged to have with us two of the top global people working at UNICEF and WHO, that is Dr. Robin Nandy and Dr. Ann Lindstrand, respectively. Today, last week, if you were at the special event, you know that we had quite an emotional moment, and hopefully left with feeling renewed, energized, inspired by the prospect of what immunization might look like by the end of this decade. I'm here with, before we introduce our presenters, I want to go to Charlotte Mbou. Charlotte, how are you doing? What is your recollection of last week's event? What did you feel, and what are you feeling now?
Thank you very much, Reda. Last week, we got to listen to lots of immunization professionals from around the world tell us about the challenges that they are facing as far as immunization is concerned, but not only that, what they are trying to do and their vision, their perspective, what they see immunization like in the year 2030. And I think it was the start of a movement that we do hope that in 9 years' time, we'll be able to gather and to say, yes, we did it. Yes, we were able to achieve something. And I'm so happy that today we'll get the opportunity to really listen to the top immunization people from WHO, UNICEF, to tell us how they see things and how they'll be able to guide and direct those professionals around the world to achieve the Immunization Agenda 2030. Thank you very much, Reda. Over.
Thanks, Charlotte. All right, there's a lot of emotion there that I heard. I want to go welcome both our guests and really go to just to give you a flavor. There are just simply too many messages to share them all. But Amel El Tahir is always with us from the Kingdom of Saudi Arabia. Welcome. But we have many new names and faces. Haruna Hassan, who's so happy to be part of this, connecting from YouTube. I spotted a couple of really interesting messages. Isaac Matene is connecting from via LinkedIn. He's a health specialist at UNICEF in Burundi, involved in immunization. And there's one message that caught my eye. Let me see. Yes. All right. And Adefunke Adesina from YouTube says, or via YouTube, I should say, Adefunke, don't forget to remind us where you're from, who says, great to be at this historical event. So I'd like to thank you for so many messages. I'd like to stop there. We're going to dive right in with Ann Lindstrand and Robin Nandy. Welcome to both of you. Would you like to say a quick word to introduce yourselves, and then we'll go right into the presentation. It's important that immunization staff receive the right technical information. That's really our purpose today.
So hello, everyone. Delighted to be with you today. And I was also deeply inspired and humbled by the first launch last week and all the stories that came out about everyone contributing to the immunization agenda, being a part of us all immunization passionate people around the world. And so I'm Ann Lindstrand, a pediatrician and unit head of the EPI program at WHO. And really delighted to be here with you now.
Thank you. And Robin Nandy from UNICEF. Of course, you'll need to unmute yourself. I'm just asking you to unmute. And this will probably happen more than
after a year of Zoom meetings, I still can't unmute myself. Very good morning, afternoon, evening to everyone. Like Anne, I was really humbled and also really excited with the session last week. You brought up some really key issues, and and hopefully we can reflect further on them as you hear from Anne and I today on the key components of the IA 2030. But I want to give my thanks to the Geneva Learning Foundation for organizing this, and to everybody for your participation. It's a busy time, so thanks for taking the time and joining this. Reda, particularly thanks to you.
All right. Thank you very much indeed to both of you, and to all the participants who are taking time out from all of the urgencies, all of the priorities that they have in front of them in order to think about together what we want to achieve by 2030. So let's have, this will not be about applause, this will be about the technical presentation of IA 2030, but before we dive in, let's All right, let's dive right in then. On my screen is the opening slide. I'm assuming, Anne and Robin, that you'll be sharing the presentation duties. Just give me the next slide directive. You should be able to make that your slides clearer. Who is going to kick off?
I'm going to kick off, Reda, and I realized when I spoke earlier, I didn't introduce myself. I'm Robin Nandy, Chief of Immunization at UNICEF. With great pleasure making this presentation with my colleague Ann Lindstrand. We're going to do a little bit of a tag team. So I'm going to run through the first half of the presentation, and then hand over to Ann to conclude. Hopefully, we'll do it in a time that we can actually spend the remaining part of the meeting responding to your questions and comments. So, IA 2030 was launched last week. Really exciting moment, and I just want to start with some key points on IA 2030. Obviously, as the name suggests, it's going to chart the course and vision for the next decade for immunization. So it is a global strategy created for all of us, the global community, and working in immunization, but not only, well beyond immunization to broader primary healthcare and public health, including disease-specific initiatives, those who work on health system strengthening and other parts of the house in terms of the health sector and even beyond. It is designed for every country. It is not a strategy or vision for simply low-income countries or simply high-income countries. It is for countries of all geographies, all income levels. And as we know, we have substantial subnational variation, within countries now. So this is meant for all countries, all subpopulations, and all communities. Sorry, these messages are coming. I can't see. Okay, so this is, and the third bullet is important. This is not owned by a single agency. This is not a WHO document. This is not a UNICEF document. It belongs to all of us. It is an agenda for the entire immunization community moving forward. Lastly, it is a living document. We have taken on board lessons learned and comments on what worked and what didn't work in the previous iteration, the Global Vaccine Action Plan that ended in 2020. And we realized that a static document over 10 years is not going to be relevant in today's changing world. And our changing world was clearly demonstrated in 2020, by the COVID pandemic and how things were turned upside down. So I think the idea is to keep this a living document and have it evolve over the course of the decade. Next. The next slide shows you the process of development. It was a hugely consultative process involving all levels, national, subnational, regional, global level. More than 900 people participated. More than 5,000 comments were received. You can look at the timeline here. And it's important to say that, as we were reaching close to the end of the development, COVID-19 pandemic hit. And so we had to make some adaptations, course corrections, and we'll talk to you about, some of these when she takes on board. But you can see it started in February, March 2019, and then concluded and launched last week. Let's move on. Next slide, please. So in terms of the top lines of IA 2030, I talked about this, a unifying vision for the decade. We've tried to align it with the SDGs. Back, please. Yeah, thank you. Our vision is a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. So, the vision you'll see is fairly broad. It is using immunization as an entry point, but the goal is good health and well-being for all individuals, all communities. Reduction of goals include reduction in morbidity and mortality of vaccine preventable diseases, leaving no one behind. I'm going to talk about that a little bit later as well in terms of how equity is a centerpiece of IA 2030, and the third impact goal on ensuring good health and well-being for everyone, strengthening immunization within primary health care. So less horizontal than perhaps traditionally we worked as an immunization, less vertical than perhaps traditionally we worked as an immunization community, and aiming to move horizontally, linking up with primary healthcare and universal health coverage. Next. This is a schematic of the 7 strategic priorities and 4 core principles. You'll see the arc in the orange, which is the first strategic priority, which is in a sense cross-cutting and stated as immunization programs for primary healthcare and universal health coverage. This is really significant. We see immunization as an entry point and not an end point. And you know, the end point will require immunization coming together with other aspects of primary healthcare and universal healthcare. Included in the 7 strategic priorities are all the key areas that I'm going to outline one by one, including commitment and demand, coverage and equity, life course integration, emergencies, outbreaks, supply and sustainability, and research. 4 core principles that underpin these strategic priorities are people-centered. We want this to be responsible to communities. We deliberately wanted IA 2030 to be less top-down than its previous iterations, GVAP and GIVS. We want strong country ownership. This cannot be driven by global level. This needs to be owned and executed by country level. And that's only, it's only then when that this will be successful. Partnership is extremely critical. There are new partners, emerging partners, and as I mentioned earlier, this is not the work of 1 or 2 agencies. It is the work of us all. And data guidance, strong evidence needs to be the basis of everything we do during the decade. Next. Okay, so I'm going to very briefly, I'm not going to read everything on the slides, but the key highlights, I'm going to walk you through the 7 strategic priorities. So one, this is the orange one in the schematic, which is kind of cross-cutting immunization programs for primary healthcare and universal healthcare. You look at the wording here. It's effective, efficient, and resilient immunization services accessible to all people, but as an essential part of primary healthcare and contributing to universal health coverage. So this includes number of elements, objectives, including leadership, management, workforce, very important. Workforce is extremely critical in us achieving objectives, surveillance, supply chains, data, and evidence-based decision-making, and very importantly, vaccine safety systems, a really important aspect in terms of maintaining vaccine confidence. In terms of key focus area, you look at the keywords, PHC strongly positioned in the IA 2030, focus on workforce. Again, I'm not going to read all of these, but you will have these as resources. Next. Commitment and demand, very important as we look at a couple of things. This strategic priority includes both political and financial commitment for immunization, but also the ensuring that immunization is valued and sought out by people in communities. So it covers a number of aspects from a political and financial commitment. We've seen that as immunization has been successful, it basically gets deprioritized and not given the level of importance. Of course, now with COVID and COVID vaccine, immunization is on everybody's lips. I think we have an opportunity to harness that, and the value in the community in the era of a huge amount of misinformation regarding vaccines. How to ensure the trust and confidence in vaccines among populations, communities, households. Next. Coverage and equity. Coverage and equity remains a centerpiece of IA 2030. It was emphasized in GVAP, but as well. But here we are taking it to another level and really focusing on the most disadvantaged population, measured by zero-dose children. So we all know that 14 million kids globally are termed as zero dose, i.e., they don't receive any vaccines. And we use DTP 0 as a proxy for this figure. But we also know that given the higher relative coverage of immunization relative to other child survival intervention, though children that do not receive vaccines are likely not to receive any other services as well. So this is the idea of zero-dose children, also recognizing that zero-dose children are clustered within some of the most disadvantaged communities. So the focus is not only on the zero-dose child, but the communities that they are clustered in. And these communities are then targeted or to be targeted for particular attention for not only immunization services, for broader child survival services. So, identifying the disadvantaged populations, identifying the barriers, gender, extremely important, the gender dynamics that determine whether a child is vaccinated or not, and learning from disease-specific initiatives like polio to reach marginalized population, and importantly, using measles as a tracer. You know that measles is one of the most transmissible of vaccine-preventable diseases, and really picks out areas of poor performance selectively. And we need to use measles outbreaks as a tracer for system strengthening. Next slide, please. And life course in integration, a realization that immunization is no longer just childhood or infant immunization and spans the life course. This is going to be further expanded. This is an expanding area of work during the next decade, particularly now with COVID-19 vaccines targeting adults, an opportunity to really push forward and position immunization as an intervention that spans the entire life course. Of course, it's completely different ball game delivering vaccines to adults compared to children, and the programs will need to adapt, and both from a supply and demand perspective to achieve this. Next. Outbreaks and emergencies, hugely important. We know that most of the zero-dose children and our underperforming areas are hugely influenced by conflict and instability, and where there's a breakdown of systems. This is going to be an area of particular focus during the next decade, and of course, an effective outbreak response. So this areas of focus includes coordination, building capacity, integrated surveillance, and things like innovation and community engagement kind of cross-cuts all these strategic priorities. Next. Supply and sustainability. We all know that supply and healthy markets extremely important. We need to make sure that vaccines are both available and affordable. A good forecasting will lead to stability in vaccine availability. We need assured quality, ability to respond to emergency situations, and the sustainability side of it, predictable resources, financing, alignment across partners, and sustainable transitions, and particularly things like Gavi transition and so on needs to be done in a way that actually does not destabilize the program. And finally, the last
can I just I just wanted to add here on this one, sure. Robin, how this IA 2030, we all worked on it together, and it was the first steps of it was presented and worked on before the COVID-19 pandemic hit. And I think this SP, has, and you are all living it right now with this strength, the supply in shortage, and the importance for us to build up manufacturing in many places, the access to the knowledge and the logistics and the finance systems so that we can actually get the immunization out. And so I think this SP, but many of the others as well, are even more relevant right now with IA 2030, with the COVID-19 pandemic, than even we conceived it, right, Robin?
Yeah, absolutely. And I think as we move along the presentation, it'll be good for you to also provide an overview of how we pivoted on IA 2030 in light of the pandemic. But that's a great point. And I think we have COVID-19 vaccines on one side, but we need healthy markets for existing vaccines as well. We've seen vaccine shortages of vaccines like IPV, HPV, and so on. And also we have other new vaccines coming up like novel OPV and so on. Next slide. Yeah, and this is the final SP on research and innovation. Again, this is another one which really we are living today, right? We have in 2020, within calendar year, the development, scale up, and delivery of COVID-19 vaccines, this is really important strategic priority area that again we are living today. But it includes other innovations, technological innovations, other kinds of delivery modes, microarray patches, and so on, and also not to limit innovations only to technological innovations, but we are innovating and have innovated across all the strategic priority areas in terms of the way we deliver services, the way we plan, the way we monitor, and so on. And there's a lot of exciting stuff upcoming, things like barcoding of vaccine vials, to monitor supplies and so on. So use of digital technology, both to, monitor programs and for beneficiaries to use send reminders to beneficiaries to come and seek vaccine. But I'm going to hand over now, next slide, to Anne.
Thank you. I just wanted to say on the
adaptation to COVID-19. Over
to you.
Thank you.
Thank you, Robin. I just wanted to add as well that all of you, the SP7, the innovation piece, I think the brightest ideas comes with everyone who's really working with the immunization program. So that SP7 emphasizes how all the good ideas on research, prioritization, new ways of delivery, and so on, that's owned by all of us, and it should be, and the good ideas is usually coming from those that are really sitting and trying to solve the ideas of how to deliver immunization in countries. But as I said, there has been a reshape and a refocus of the initial steps of IA 2030, and obviously so, because we have all at all levels in immunization dropped what we have at hand, and we are very much focused into the rollout of the COVID-19 vaccines, right? So the global priority now is a rapid, equitable scale-up of COVID-19 vaccines. But at the same time, every time we speak about Immunization Agenda 2030, it's not only about COVID-19 vaccines, it's about the disruption and the damage that the pandemic has made to the regular programs and the protection of children and other protection of other antigens and other vaccines across the life course is as important and may pay us more deaths and suffering than actually COVID can save us. So really, we have to think twice at the two at the same time, the rollout in an efficient way, but trying not to disrupt as much as possible the regular immunization program. So we know that HR, so the staff in countries, resources of finances, is taking up a lot of the space in ministries of health around the world right now. But we need to make sure and guardrail also the essential health services, the primary health care services, delivering both vaccines and also other essential services. So on also countries now are looking at a new way of vaccinating and targeting adults in a new way. So I think we're all learning as we go how to reach the healthcare workers and the adult population in a much stronger way. And it is an opportunity how to do this. An increased risk of equity gaps, both because those left behind are usually the ones that are the left out, the zero-dose communities, and with the disruptions of the immunization services, of course, which societies, which communities pay the most? Well, it's always, as always, those ones that usually come are the least served from the beginning. So the adaptations that we are thinking of now and looking at and framing and discussing, and I hope you're doing the same, is that it's a fantastic opportunity with immunization right now being a global priority at highest level of political leadership in almost every country across the world. And let's ride that momentum. In the SP2, the political commitment, we know that it's really important. This is the moment where we in immunization really can make a case for the life-saving immunizations that you are delivering every day. So we look at now a focus on delivery, but then what we want to do is rebuild and strengthen the immunization services, particularly into those zero-dose communities. We see IA 2030 as an umbrella model. It's including COVAX, Gavi, many different other strategies. Let's have one place where we all come together and push forward the agenda and the technical pieces we know will work and are important. That's how we see IA 2030. And the life course approach, which is obvious right now with the adult programs that are being given first by COVID-19 vaccine. The beef up of communication and advocacy, which is very key because the trust in immunization is also fragile with this very fast rollout now, and rumors being circulating very fast during the pandemic as well. So what we want to make is the strong case that immunization is not just good because it saves lives and saves suffering, but it's also really important for economic recovery and global security. That's our strong role. And there is absolutely, hardly, I think, any other public health intervention that is so cost beneficial as immunization. So we have a strong case. Next slide. So to operationalize this agenda, we hope that all of these pieces that you see together on this slide will make a difference. So we have the vision, we have the global strategy. That's not enough. What we need is thorough plans at global level, at regional levels, with specific priorities, because all regions have different things facing them. And in countries, most importantly of all, the national immunization strategies that should be built maybe within health plans, but really have a focus and bring in the good ideas of IA 2030 into those national immunization stakeholders. I hope you will all be champions for actually making sure that happens, that the flavor of the key actions that has been proposed by all of us in the SPs actually show up, but are prioritized in your context. What is important to you? Is it finding those equity, those zero-dose children? Do you have a lot of outbreaks to deal with? Do you need to expand the market and the supply? What are the things that really feel is important to you and your region and your country? And then the monitoring and evaluation framework, that is minimum at global level and then tailored to regional and national immunization. What is important again to the region? This is not a one-off strategy. It is a flexible one that should be owned and built like that. And then the ownership accountability framework, which builds on the strong structures that you live with in the countries, maybe the NITACs, maybe the ICC, maybe other pieces where you come together as a partnership to think about ownership and accountability and assess every year, how is it going? What can we do better? And follow, all the global discussions as well, regional discussions about maybe some of key actions advised that we all agree are the most important to take in every place. And then communication and advocacy, that is still key. I think that when COVID-19 vaccine and the pandemic maybe fades away in president's mind, the communication and advocacy still needs to be there to be reminded how important immunization is for global security. And all of that together will drive the agenda. So what we're doing right now is building the terms of reference, building the different groups, and there will be a strong global partnership and holding partners at the global level accountable for actually responding to the needs in the countries that face the countries year by year during this decade. So next slide. So as I said, the national immunization strategies, there is guidance that is being built, and it is available July 2021. So since it will be available, it's already available in pilot settings in Zambia and some other places where it's piloted out, but the guidance will come out to be able to do thorough, good planning of national immunization strategies, taking into account the IA 2030, aligned with the global strategy, and streamline high-level strategic document that it's rather than a detailed operational action plan. This is really about the big pieces which needs to be in place in every country. And it's important that it's owned by the national directional documents and based on national dialogue. No one external can make the commitments that the countries can do themselves, of course. And then integrated into the larger picture of national health structure plan or primary healthcare strategy plans, so that it's a unity that makes sense and it expresses the needs and the prioritization that the countries do. This is what the national immunization strategy is. So I hope that you also will be very much champions in tailoring this in each one of your countries, whatever shape or form it is. The guidelines coming out are just a key that could help. The important thing is that the national dialogue prioritize what is important to each country. So next slide. There is an M&E framework. So Robin was telling us about it, 3 impact goals, 21 strategic priority objectives, and only the 7 indicators actually have targets at global level. The other ones will be collected, but the targets can be set at regional and national level. Same thing with the global, the 21 strategic priority objectives. There are lots of indicators that can be chosen to be important for your context. Next slide. So there's another landscape that we're trying to rewrite with IA 2030, and that is the key core principle of IA 2030 of country ownership. It's ending the time when global health agenda are being set and should be set at some kind of global level. And it needs to be another way of language. It's a country-owned process. You need to have what is feasible and seen as important in your area. And these disease-specific initiatives have been immensely productive, important, focused. Many of you worked within the polio program, and you know how successful it's been. And it's important. However, we do think it's important also to align, work together as a unity under the umbrella of IA 2030. So we're having dialogues with all these measles, rubella, yellow fever, cholera, tetanus, and so on, to think about the most efficient way of packaging, working together, aligning agendas. And it is a difficult one because many vertical programs have been working in a silo until now, but I can tell you the issues are advancing and they're coming up because we asked countries during the different consultations in IA 2030, what do you want? And it was really a clear message, integrating the vertical programs into more strong primary healthcare. Next slide. So this is just a way to show you that these ongoing dialogues, the measles rubella strategy that has just been developed is actually mirroring the IA 2030. And actually the same thing with the polio program now. They are using the same umbrella, but adapting it to the immunization program and just showing that every piece of the 7 strategic priorities are super relevant for MNRI and for the GPI as well. Next slide. And I think that's maybe the final one. Yes. So, you know that we had a launch of IA 2030 last week, the 26th of April. And it was announced in a press conference and in Geneva Learning Foundation. And next step is that we'll have a virtual celebratory event in autumn in 2021. So what we're trying to do is there galvanize even more leadership and celebrate the ambition of this era of vaccines. We'll have the baseline data of the M&E. We want to highlight country stories. We want to highlight national immunization champions. This is the country voice that needs to be speaking. And I count on all of you that you will also be out there speaking on behalf of IA 2030 after this scholar course is over. So it's really a community call for action in every possible way. And I think during this course, you're going to be discussing more and more about this. So a question for you is, will you be an IA 2030 champion and help to share the messages? And can you share with us exceptional stories of why it matters to you to maximize the impact of immunization and achieve the IA 2030 ambitions? Thank you so much.
Thank you to Ann Lindstrand and Robin Nandy from WHO and UNICEF respectively. We're discussing, of course, Immunization Agenda, and we'll be sharing the slides and other resources. I now want to go to Charlotte Mbu, who has picked out the 2 top questions in the Q&A in our Zoom studio. Charlotte?
Thank you, Reda. So the very first question that got 15 votes is from Sucheta Rawat. He says, how to bring attention of higher authorities in child immunization as priorities change as per the current situation, like COVID-19 has taken away all the attention. Sometimes it's women's health, other times it's some other health issues that political parties may have set out for health authorities. In such scenario, how do you make sure that authorities also take interest in immunization activities? So that's the first question. Do I go to the next question before turning towards Ann and Robin, Reda? All right, so the next question is from Mohammed Taimo. He says, EPI staff are engaged directly or indirectly in COVID-19 vaccination, and that will continue for at least the next 5 to 7 years in underdeveloped countries. COVID-19 itself has reduced the immunization coverage. How will IA 2030 be able to tackle these issues? Because on ground, things are totally different. Thank you.
Can I start to, would you mind if I start with the second question? Because it's really, really close to my heart. And maybe it links to the second one. Robin, are you okay with that?
Yeah, go ahead.
I mean, I think that it's really striking. Everyone is struggling with the COVID-19 vaccine rollout. And what is more urgent we all know that it's going to be worse because the doses will be coming up and ramping up in hundreds of millions during the next half of 2021. So we haven't seen the end of the pulling of resources, the stretch on API, the stretch on HR in every country of the world. Everyone is stretching. High-income countries, middle-income countries, low-income countries, everyone. This is a really, really tough administrative struggle. We have many different vaccines with different administration, different training programs is needed. And it's a stop and go with a supply that is halted or coming, and they're coming from different streams. COVAX, bilateral, it's really, really, really tough. And EPI is the technical capacity in country that can really build this and do this. And that's why you're being pulled out as well, right? But I think that what we need to do is think about it as a unity, and bring the opportunities of this rollout to also benefit the EPI programs. So there are a zillion of different things that I really, really see as fantastic happening here. You have the political attention, you have resources coming from so many places, the World Bilateral Banks and everyone. So lots of new resources are coming, and you can build out the cold chain, the whole armada of cold chain equipment in a country due to these new resources coming in, right? And those will stay on after maybe the first rush of COVID-19 vaccine rollout has faded away. They will stay there if we keep maintaining those equipments. And the safety systems that you're building up now in the wave of COVID-19 rollout, they will also benefit the routine immunization later. The digital tool and the real-time and monitoring systems that are being built out right now, are good for COVID-19 vaccine rollout, and we're learning as we go. But they will be fantastic also. The GIS systems, the micro planning systems, all of this. Let's see that we take care of the funding, resource, attention, and bring all of those things, safety, digital tools, into the support of immunization programs in later stage. So I hope it will be a win-win someplace, and not one program paying for the other. Let's look at it as a unity and take the opportunities that are there. Maybe you want to take, and it's actually linked to the first question, how do we keep the priority of the political leadership? Do you want to take that one, Robin?
Sure. I'll just start with just adding a couple of points to your points. You've answered this very comprehensively, and these are great questions, and they're both interlinked. I want to reiterate what Anne said in the beginning. The disruption to immunization as we roll out COVID-19 has the potential of getting worse as more and more doses of COVID-19 vaccines are available. Many of you have mentioned in the chat that most low and middle income countries do not have experience in targeting adults with vaccination, which, as I mentioned before, is a completely different ballgame, both from the supply side as well as from the demand side. I think the key, just to add to Anne's comprehensive response, is it's really important that we advocate for the programs and policy makers to plan for and ensure adequate resources for COVID-19 vaccine to be introduced in parallel to continuation of childhood immunization. And this is something, as WHO, UNICEF, Gavi, all the partners have been saying it. We've been saying it to donors, we've been saying it in media reports, that these need to be adequately and independently financed so that they can happen in parallel and one does not come at the cost of the other. And I think every subsequent measles outbreak or every subsequent polio VDPV outbreak, we need to use as a red flag to policy makers to make sure that childhood immunization is adequately resourced. The first question is related to this. How do we keep immunization at the top of the agenda? I alluded to this in my presentation, is there's been a waning of attention on immunization as we do well. So since 2000, we've done really well in reducing measles mortality, for example. And then what happens is we get complacent. Attention gets diverted, resources get diverted, and boom, what happens? The Latin America region loses their measles-free status. We see huge number of outbreaks, and I'm talking about pre-COVID as well. So our challenge in IA 2030 is going to be keeping immunization at the center of the agenda throughout the decade, not for the first 3 years, not for the first 5 years, but for the entire decade. The way we can do that is harness, as Anne says, the attention, the unprecedented attention. Everybody on the street now is become a vaccine expert. They're discussing vaccines. And this should not stop at COVID-19 vaccines. And we need to use this to harness the attention of to all vaccination across the life course. And I think that is going to be, really key moving forward. And you all have a role to play here. You all have a role to hold your countries, your governments, your stakeholders, including WHO and UNICEF, accountable for keeping this on the radar. The other thing I should add will be important to keeping it on the radar is not appearing to come in as immunization people advocating for immunization in isolation. I think this is really important. If we can position immunization as an entry point, as a marker of equity of all health services, primary health care and so on, and bring others along with us, those working in other parts of health and nutrition. I think we want to do that. We want to do that. We do not want also COVID-19 vaccines to become another polio program, for example, and go single antigen, reaching marginalized communities that are not receiving any other services. So where there are opportunities, humanitarian context, where we roll out COVID-19 vaccines, we need to use that opportunity and contact with that community to deliver multiple interventions. We need to change our own mindset as immunization people in order to do so.
Thank you very much, Robin and Anne. We have a lot going on. We have an active chat in our Zoom studio. We have many questions that are waiting for attention. Definitely there's something special happening here. I want to pull in some of the comments. Let's go to the different platforms. So we're live streaming this across YouTube, LinkedIn, Twitter, and so on. So Rosina Mystery, for example, says, I wish civil society was there in the people-centered component. I somehow feel civil society should meaningfully engage, she added. Rajat Garg and many others brought up, the issue, the impact of COVID. He says we should consider that impact for the next 2 or 3 years. We've been discussing that. Amel El Tahir says, leave no one behind is IA 2030 planning to have the same immunization schedule across the globe, though with respect to the epidemiological situation in each country. So that's a technical question. But and then there's another technical question. This is from Solange Wegang from Cameroon. She's a statistician, alumna of the Survey Scholar program from WHO. She says, thanks for the presentation. What she wants to know is, what is the indicator for zero dose? What source of vaccination is considered here? Because I know about cards, tick marks, it's impossible to present results by sources. And then last but not least, I'd like you to ask you to answer those two technical questions. We have a lot of enthusiasm. So Nasiru Abubakar, who says, hello, I'm very excited to be part of this agenda. A lot of praise and gratitude expressed for the presentation. And let's see, Joyce, who says, I'm very excited to hear that immunization movement is collaborative movement, engaging every section of society, everyone who can make a difference in supporting the IA 2030. So Anne and Robin, if you could address those two technical ones and also respond to the both the civil society question and just this enthusiasm that this seems to be sparking amongst immunization professionals.
So the zero dose indicator is DTP1. So that's in the M&A monitoring and evaluation framework, DTP1, as an indicator for the children that never ever get access. But the immunization agenda is really stressing that it's not just going from 0 to 1, it's going from 0 to a fully immunized child. And it's really, really important that we don't have a single view of just getting that first dose in and we're fine. We know all that. We know that children need booster doses. We need a complete schedule. We want all antigens. But the indicator, just as an indicator to show us the way, is the DTP1. I wanted to pick up on two of the comments here. The CSO, but I also liked the last comment about a movement, because actually, in many of the creative sessions around IA 2030, this concept of a movement has been coming up more and more. And that's exactly what we need to have, like everyone owning the immunization concept, the importance of it, that everyone can take to heart for themselves, their children, and the healthcare workers delivering it, and at the public health authorities and also at the political leadership. Everyone owns the ownership and the importance and the value of it. And that's what we want to create, that movement of saying, yes, we want, yes, we think it's important, and yes, let's put resources and efforts into this. So I think, and finally on the CSO, maybe it didn't come up enough in the ownership and accountability, but the mechanisms of every level of ownership and accountability, so the governance structures, there is CSO representation. And you know that for this to be a movement, the CSOs are the far-reaching voice, being in communities who can find the zero-dose children, who can help with the delivery of immunization, who can help deliver health messages and the importance of immunization. So yes, at the heart of every level, from the zero-dose community to the whatever ownership and accountability at country level, regional level, and global level. That's where we want the CSO voice as well. And I think, yeah, thanks. Over to you to continue.
No, just to add very quickly, I want us to go to the next level of questions. This is about answering questions, so we don't want to talk too much, but make sure we answer your questions. But as Anne said, the zero dose is the other way I describe it is that the zero dose is an entry point and not an end point. The end point is not DTP1, it is fully immunized child, but also comprehensive primary health care. So that we want immunization zero dose to resonate with people outside immunization as a marker of most disadvantaged communities. I want to reiterate the shift between a zero dose child and the zero dose community. These are communities where large number of zero dose children are clustered and are some of the most underserved or deprived communities. There was a question asking if IA 2030 is promoting the same vaccine schedule for all countries. Absolutely not. Vaccine schedule in the country will be based on epidemiology, local epidemiology. Obviously, yellow fever vaccines will be in a handful of countries. Meningitis vaccines will be in a number of countries, not all countries. Similarly, Japanese encephalitis. So the immunization program in countries will be tailored based on their local circumstance, context, and epidemiology.
Thank you both. We're going to go back to Charlotte and Boo, who's picked out top questions either from the Q&A or from the chat. Charlotte?
Yeah, thank you, Reda. So there's the next two questions from Mohammed Imran Qureshi. He asked, how will Immunization Agenda 2030 help countries in achieving the immunization-related sustainable development goals, ending also in 2030? And then the next one is child immunization program, although well known, but the adult immunization program is literally unknown in many parts of the world. Are there any plans for adult vaccination regarding Immunization Agenda 2030? So those are the next two questions.
So,
Robin?
Yeah, sure. We'll mix it up, and let me go first, and then you come in. No, I mean these are two really really good questions. I think we have tried to align IA 2030 very closely with sustainable development goals. You will see slides in various presentations as well, including presentations from Gavi, that immunization has the potential to contribute to 14 out of the 17 SDG goals. Obviously, SDG 3 would be the most direct contribution, but there are other a number of other areas that immunization can contribute to. So goals and targets of IA 2030 will directly contribute to SDG 3, but some of the other SDGs as well, and we have tried to align that. And I hope that provides an overview. In terms of what was the second one? The second one was
adult
Adult
adult.
vaccination.
Yes. Look, we've Anne has mentioned this. I've alluded to this as well. Is low and middle income countries, and I've got very little experience in adult immunizations program, and I think IA 2030 does factor in the possibility of countries building up their adult immunization. And that's the a strategic priority on vaccination across the life course. So we see immunization not only an infant or childhood program, but across the life course. I think COVID-19 provides huge opportunities to actually build a platform for adult immunization. How far we'll go in the next 10 years, particularly in low-income countries, is going to be, we'll have to wait and see. But one of the areas to start off with is vaccination of health workers. We know that COVID-19 vaccines have initially targeted health workers. We have seen similar targeting of health workers with Ebola vaccines, and so on. And I think, we can start off with a platform for vaccinating and protecting our health workforce. We have seen how critical the health workforce is and how morbidity and mortality among the health force, affects the functionality of the health system. Over to you, Anne.
Yeah, I just wanted to say that adult immunization programs and healthcare worker immunization programs is a problem in many parts of the world, in high-income countries and middle-income countries and in low-income countries. It's suboptimal and it's not well enough. So the SP4 is really pushing that level. And I hope that at the end of this decade, every country in the world will have a defined adult immunization schedule, and to be able to protect. WHO comes out with recommendations. So I mean, the recommendations and the assessment of these in adults it's fine. We have the recommendations, but the commitment and a schedule for adults that's not existing in many countries. And so certainly not the platform and the way to do it and the way to finance it. So I think if we can meet again here in 10 years, and I want to see how many of your different countries can show the adult immunization schedule, I'd love to see that. And so let's work on that. I think it's really key. I think it's really important. And it's important also to break the level of, you can only give measles and yellow fever in one type of age group. That's not true. You can give it along the whole year. If you've missed it, you need to catch up. It needs to be, a possibility to be able to be offered vaccines that can save your life at every age, and particularly for measles and yellow fever.
Thank you both. We're now going to go to the participants to hear from Zainab Garba. Zainab, I know your microphone is working. Please go ahead and unmute. And please, Francophones included, you can raise your hand. We would love to hear from you. We have only a few minutes remaining. I hope Anne and both Anne and Robin will be able to stay for a few minutes beyond the allotted time. Zainab, would you be able to, I'm asking you to unmute. It won't work otherwise. Let's go to Jackie Fumbi and another person. Okay, Zainab, yes, please go ahead.
Okay, good afternoon. So I
please
was actually
introduce
going
yourself
through
first.
The questions.
Yep.
Okay, my name is Zainab Garba. I'm calling from Abuja, Nigeria. I'm a public health nurse. I work with the Federal Ministry of Health in my country. Okay, so I was going through the questions and I thought that I saw some that were applicable to my country. Like, for instance, the apathy of people towards the COVID-19 vaccine and what we would do to scale up people taking up the vaccine. Okay, so probably because of trust issues and other logistic issues.
Zainab, I think we've understood the gist of your question, or the topic that is of concern to you. Anne and Robin, is there anything you'd like to add at this stage about responding to her concern?
About trust in vaccines, I think that's also a struggle that we all face in immunization. And the only thing we can do is being honest, transparent, thorough, lean on evidence, lean on science, and equip, I think, particularly the healthcare workers with the latest. You, as public health nurse who meets the persons, the population, give quality services and be able to just be there, listen, and respond faithfully and respectfully, and then be informed yourself about the science and be able to give the response that the mother, the patient is bringing up. I think it is one of the key challenges that we're not only facing in COVID-19 vaccine, it's spilling over on other vaccines. I've heard that from Nigeria in last week's session as well. So it is something that we all need to own and work on, not just communications, but have everyone on board, have the champions on board, have the scientists in your country on board. Use your NITAG networks, your respected scientists in the countries, and bear that voice of reason and of truth. Everything that you know, transparent, and everything that you don't know, transparent. Over to you, Robin.
No, absolutely. Just to add that, again, I mean, I really highlight the importance of trust. And as Anne said, trust is not only communication. It's the way services are delivered. It's the way health workers communicate with the beneficiaries. And I think we need to look at trust much more broadly than a communication solution. Quality of services becomes very important. I think it's also important to tease apart confidence and trust in COVID-19 vaccines versus trust in childhood immunization. They are two different things. The approach and the way we're going to address that. So, my plea to you all would be to look at your local context. Try to really understand what the causes are of the distrust and hesitancy, and then take steps to address them. It's not going to be one size fits all. Even in a country as big as Nigeria, it won't be one size fits all for the entire country. You might have to look at subnational pockets and see how you respond to those, and bring people along you, in addition to scientists and so on, as Anne said, traditional leaders, religious leaders. We need to create a coalition of the willing. And that's in the principle of IA 2030. It is all encompassing. It is for everybody. It is for us as immunization people to bring everybody together. It's our job. Tough job, but it's our job.
Thank you, Anne and Robin. We have, I believe we have 10 hands raised. Obviously, we're already over time. We're not going to get to everyone. But as I said last week, for those of you who attended the special event, this is the beginning of a conversation. We're talking about a decade-long process, and a decade-long really of collaboration, including new forms of collaboration. I do want to go to Mohammed Imran Qureshi. He is a longtime scholar, alumnus from Pakistan, and is currently working actually on a new kind of dialogue between alumni from our programs from between countries focused on COVID-19 vaccine introduction. But I'm sure he has questions specific to IA 2030 for Anne and Robin. Mohammed Imran Qureshi, welcome. The floor is yours.
Thank you very much, Reda, for the introduction. I won't go into my introduction. You have already introduced me. I'm Dr. Imran, working as technical officer in EPI WHO Punjab, Pakistan. So my question that it goes without saying that a lot of progress has to be made with regards to infant and childhood immunization program, especially in developing and underdeveloped countries. And a lot of progress need to be made with regards to VPDs and the targets and objectives and international commitments. But with regards to the adult immunization program, I believe that we need to put foundation stones during this Immunization Agenda 2030 with regards to the adult immunization program. At least if we could figure out what are the risk groups, how we can vaccinate them to minimize the overall disease burden. For example, we have a lot of food handlers, so we could go for their typhoid vaccination. We have like a lot of prisoners, we go for their vaccination. We have a lot of other similar risk groups with regards to the adults, and we can go for their adult vaccination. Similarly, like the foundation has already been provided by the COVID vaccination, which we have to go for it. And secondly, I want to make a brief comment regarding the major challenges and issues we are facing these days. That although demand generation has a lot of aspects to be covered and a lot of attribution with regards to the immunization program, but I believe that a lot of coordination and collaboration gaps are there between different stakeholders and different departments that need to be considered if we really want to achieve all the objectives and goals of Immunization Agenda 2030. Thanks for providing this opportunity. Over.
Thank you. Thank you very much indeed. Imran, before we go, let's hear from a couple more people. We have Jackie Fumbi. Let's go to Jackie Fumbi. So if you can unmute yourself, I'm asking you to unmute. I'm also going to ask, let's see, Akafu. Yes, Jackie, we are listening. You are on the air. Jackie, you had your hand raised. Please go ahead.
Bien avec ça.
All right, let's go to Ablas Albert. The floor is yours if you can figure out how to unmute your, and then there we also have Akafu CPEV Buffing. Okay, let's go to Atahir Abubakar.
Yeah.
Yes, Atahir.
I think I'm very excited to be part of this memorable event. Just a short word. I listened to the two presenters with an excellent and rich presentation. My worry is how will WHO and other donors make countries like in sub-Saharan Africa to be accountable to immunization activity. Now, COVID has turned the government away from routine immunization. Attention has been focused mostly on the COVID vaccine. Now, routine immunization is going down in most of the areas in the country. Thank you very much.
All right, that'll be our last question for today, but the conversation will continue. I'll explain exactly how that's going to happen, but let's first hear from Anne and Robin, both your responses here, and closing thoughts, knowing this is only the beginning.
Yeah, so just let me, I think the last question was for WHO and other, but the immunization agenda will come up on the agenda every other year at WHO. So all the health ministers around the world will be scrutinized, I can't maybe say that, but really look at strongly what's working, what is not working. I think that is one key moment when everyone will feel, every country will feel responsible, including those in sub-Saharan Africa. And then there is also the ownership and governance mechanism around at the global partnership. We'll have a multi-disciplinary team looking at the data and being able to strongly send messages and amplified by advocacy groups like the CSOs when something is not working. So I hope that the M&E together with the ownership and accountability mechanism and WHO together will be a strong voice pushing everyone not to forget the immunization programs.
Robin?
Yeah, just not a lot to add, but I think you all have a role to play at country level. CSOs have a role to play in demanding for service provision and so on and so forth. So we have to come together. There's only so much that we can do at a global level. The real action will happen at national and importantly at sub-national and service delivery level. So I think everything that we can do to hold all ourselves accountable to the delivery is going to be important. I'm just looking at the chat, a lot on vaccine trust and misinformation, and this is going to be an ongoing conversation. But I just want to say, and I've looked at one chat which says misinformation and hesitancy. I want to tease those two apart. I will argue with you that misinformation doesn't automatically result in hesitancy or rejection of vaccine. Misinformation can be largely negated if there is trust in the vaccine, in the system, and in the services. So sometimes suboptimal quality of services and people rejecting those services is seen as hesitancy. That's not really hesitancy. That is concern about the quality of performance. So the point I'm making is tease apart the problem that you're trying to solve really, really carefully, and the solution will present itself to you. Thank you very much to you all for your participation and the excellent questions that you asked.
Wonderful. Thank you both. Let's close now this inaugural lecture and discussion. We are not done, though. You can see here the Immunization Agenda 2030 website. I encourage you to go look at it now. Go have a look. You can see the vision and impact. The strategic priorities are all here, as well as the core principles. Take your time to go through it. Of course, for some of you, you are participants in the WHO IA 2030 course, so you will need to pay attention to this. But wherever you are, whoever you are, whatever country you may be in, whatever your immunization work focuses on, it's worth going through it, getting a sense of what, as a global community, we will be trying to accomplish in the coming, in this decade. Once again, thank you for your attention. We're now going to do a rewind of the comments, just to review some of what's been said. Thank you to our guests and presenters, Ann Lindstrand and Robin Nandy from the World Health Organization and UNICEF, respectively. Thank you and goodbye. Some great comments from Amel Elta here, who says, for me, Geneva Learning Foundation platform is the place connecting all immunization professionals from the globe to align them to contribute in immunization program. Credit back to you, Amel, and all the others who have spent time and dedicated time to study, to going above and beyond what was expected of you. Joyce says, thank you for all the information. It helps us build a knowledge base to support the IA 2030 movement. We also have many. Let me just go and review some of the comments. So Lara Adeyemi, thank you. Solange, Marie-Michel, Mohamed Ibrahim, so many of you. We're now going to do the traditional rewind of the comments. Take care.